What are the alternatives to bumetanide? If you are curious about what options exist besides bumetanide for managing hypertension, you are in the right place. Bumetanide is a loop diuretic that helps the body get rid of excess fluid and salt. It does this by increasing urination, which can lower blood pressure. But there are several alternatives to consider if bumetanide is not the right fit for you. First, let's look at other loop diuretics. Furosemide, commonly known as Lasix, is a popular choice. It is effective for fluid removal but requires monitoring of electrolytes. Another option is Furosemide, which has a longer half-life. This means you can take it less often, making it more convenient. Ethacrynic acid is another loop diuretic, mainly for those who cannot take sulfa drugs. Next, we have thiazide diuretics. These are often the first choice for treating hypertension. Chlorthalidone is a well-regarded option that helps manage blood pressure and swelling. Hydrochlorothiazide is another common medication for hypertension and mild fluid retention. Potassium-sparing diuretics are also available. These help keep potassium in the body while promoting the excretion of water and salt. They are often used alongside other diuretics to maintain potassium levels. Examples include spironolactone, amiloride, eplerenone, and triamterene. If diuretics alone do not work, other classes of blood pressure medications can be considered. Angiotensin-converting enzyme inhibitors help relax blood vessels, which can lower blood pressure. Angiotensin Roman II receptor blockers work similarly but are often better tolerated. Calcium channel blockers relax blood vessels and reduce the workload on the heart. Beta blockers lower heart rate and output, which can also help with blood pressure. When choosing an alternative to bumetanide, it is essential to consider your overall health. Factors like kidney function, electrolyte balance, and other health conditions play a role in this decision. Regular monitoring is necessary to avoid complications like electrolyte imbalances or dehydration. In many cases, thiazide diuretics like chlorthalidone are recommended as the first line of treatment for hypertension. Loop diuretics are typically reserved for those with significant fluid retention or heart failure. In summary, alternatives to bumetanide include other loop diuretics like furosemide, Furosemide, and ethacrynic acid, thiazide diuretics such as chlorthalidone and hydrochlorothiazide, potassium-sparing diuretics, and various non-diuretic blood pressure medications. The best choice depends on individual health needs and treatment goals.